So speaking about knee osteoarthritis in patients, knee osteoarthritis is a frequent disease. More than 10% of individuals over 60 years old, and more than 75% over 80 years old. But 80% of patients with knee osteoarthritis do not experience real daily knee pain. So these patients should not receive a joint arthroplasty. However, due to their age, 50% has contraindication for non-steroidal anti-inflammatory drugs, and 30% take some opioid drugs with adverse consequences. They receive also corticosteroid injections with a risk of accelerated joint degeneration. As a result, 20% of this population will receive a total knee arthroplasty. But however, as a result, 25% of these patients after their arthroplasty are unsatisfied. And 20% are satisfied but continue to take opioid drugs. And 25% will need more than 4 months for an improvement of the function. And you know the consequence of the opioid epidemic or scandal, as you want, with an increasing number of deaths, and the orthopedic surgeons have probably some responsibility in this event.